Your feet are trying to tell you something that could save your life, and most people over 50 are completely ignoring the warning signs. Right now, at this very moment, your body may be sending you signals through your feet that your blood sugar is rising, that silent damage is already happening to your nerves, your circulation, your kidneys, and your heart. And the tragedy is that by the time most people notice these signs, by the time they finally mention them to their doctor, years of damage have already been done. My name is Dr. James Harlow. I have been practicing general and preventive medicine for over 20 years, and I can tell you without exaggeration that I see patients every single week who come into my office with serious complications from high blood sugar, from prediabetes that turned into full diabetes, and almost every single one of them tells me the same thing. They tell me their feet had been trying to warn them for months, sometimes years, and they just did not know what they were looking at. They thought it was just aging. They thought it was poor circulation from getting older. They thought it was nothing to worry about. Let me tell you about a patient I saw just last month. Her name was Margaret, 68 years old. Retired nurse, ironically. She came to see me because she had developed a small cut on the bottom of her foot that would not heal. She said it had been there for almost 6 weeks. She had tried antibiotic cream, she had kept it bandaged, she had done everything she thought she should do, but it just would not close up. When I examined her foot, I saw the cut, but I also saw something else. Her skin was extremely dry, almost like parchment paper. The color of her feet was slightly different from the rest of her legs, almost a pale grayish tone. And when I touched her foot with a simple monofilament test, a basic tool we use to check nerve sensation, she could not feel half of what I was doing. Margaret looked at me with genuine confusion when I told her we needed to check her blood sugar immediately. She said she had never been diagnosed with diabetes. She said her last physical was 2 years ago and everything was fine. But when we ran her blood work that afternoon, her fasting blood sugar came back at 148 milligrams per deciliter. Normal fasting blood sugar should be below 100. Prediabetes is 100 to 125. Diabetes is 126 and above. Margaret had full diabetes and had no idea. But here's what I want you to understand. Margaret's feet had been trying to tell her for at least 2 years, probably longer. The dry skin, the color changes, the loss of sensation, the slow wound healing. These were not random symptoms. These were not just signs of getting older. These were direct, measurable consequences of elevated blood sugar damaging her peripheral nerves and her circulation, and her body had been screaming at her to pay attention. So what I am going to do in this video is walk you through exactly what to look for in your own feet, explain why each sign matters, what it means physiologically, and what you need to do about it. Because here is the truth that most doctors simply do not have time to explain in a 15-minute appointment. Your feet are one of the earliest and most reliable warning systems your body has for rising blood sugar. The signs show up there first, often years before a blood test would catch it, often years before you have any other symptoms at all. Now, if you are watching this and you have already noticed any strange changes in your feet, anything that feels off, anything that has been bothering you but you have been putting off, getting checked, I want you to write the word checking in the comments right now. And if this is the first time you are hearing that your feet can warn you about blood sugar problems, write first time below. I read every single comment, and I want to know how many of you are experiencing this, so I can make more videos that address exactly what you are going through. And while you are down there, please make sure you are subscribed to this channel and that you have liked this video, because it helps me reach more people who desperately need this information. Let me explain what happens inside your body when blood sugar starts to rise and why your feet show the damage first. When you eat, your body breaks down carbohydrates into glucose, which is sugar. That glucose enters your bloodstream, and your pancreas releases insulin to help move that glucose out of your blood and into your cells where it can be used for energy. This is normal. This is how your body is supposed to work. But when you consistently eat too many refined carbohydrates, too much sugar, too many processed foods, or when you are sedentary and carrying extra weight, especially after the age of 50, your cells start to become resistant to insulin. They stop responding to it the way they should, so your pancreas has to produce more and more insulin to get the same job done. Your blood sugar stays elevated for longer periods of time, and over months and years, this chronic elevation of blood sugar starts to cause damage. High blood sugar is toxic to your nerves and your blood vessels. It causes inflammation throughout your entire body. It damages the delicate lining of your arteries. It interferes with normal circulation. And the places in your body that are farthest from your heart, the places where circulation is already the most challenging, those are the places that get damaged first. Your feet, your lower legs, your hands, but especially your feet. The first sign that most people notice, and the one that is easiest to dismiss, is a tingling sensation. It usually starts in the toes. People describe it as pins and needles, like when your foot falls asleep. But this tingling does not go away when you move around or change position. It is there when you wake up in the morning. It is there when you go to bed at night. It might be worse at night, actually, because when you are lying down and not distracted by activity, you notice it more. This tingling is called a peripheral neuropathy, and it is caused by damage to the small nerves in your feet. High blood sugar interferes with the way nerves transmit signals. It damages the protective covering around the nerve fibers. It reduces blood flow to the nerves themselves, starving them of oxygen and nutrients. And once nerve damage starts, it is very difficult to reverse. You can stop it from getting worse, but you cannot usually undo what has already been done. I had a patient, a man in his early 60s, who told me he had been feeling tingling in his toes for almost a year. He thought it was because of the steel-toed boots he wore at his job. He thought maybe his feet were just compressed all day and that was causing the sensation. He never mentioned it to anyone until the tingling turned into numbness. And by the time he came to see me, he had lost almost all sensation in both feet, from the toes to the middle of his foot. His blood sugar had been elevated for years. The damage was extensive. And it all started with a tingling he ignored because he thought it was just his boots. The second sign is a burning sensation. This is different from tingling. People describe it as if their feet are on fire, especially at night. They tell me they have to stick their feet out from under the covers because they feel so hot. They wake up in the middle of the night because the burning is so intense. And this is not a temperature issue. When you touch their feet, their skin is not actually hot. But the nerves are sending false signals to the brain, telling the brain that the feet are burning when they are not. This happens because damaged nerves start to misfire. They send pain signals when there is no injury. They interpret normal sensations as painful or burning. And the reason this gets worse at night is because when you are active during the day, your brain is distracted by other inputs. But at night, when you are trying to sleep and there is nothing else competing for your attention, those misfiring nerve signals become overwhelming. The third sign, and this one is incredibly important, is changes in the color of your feet. When blood sugar is chronically elevated, it damages the small blood vessels that supply your feet and legs. This reduces circulation, and when circulation is reduced, the color of your skin changes. Your feet might look pale, almost white, especially when you elevate them. Or they might look darker, more purple or reddish, especially when you let them hang down. You might notice that your toenails are growing more slowly or becoming thick and discolored. You might see that the skin on your feet looks shiny and thin, almost translucent. These color changes are a direct sign that blood flow is compromised, and compromised blood flow means your feet are not getting enough oxygen. It means that if you get a cut or a blister or any kind of injury, it is going to take much longer to heal. It means you are at higher risk for infections. And it means that the nerve damage we talked about is going to get worse because nerves need oxygen just like every other tissue in your body. I treated a woman last year who came in because she was worried about a dark spot on her foot. She thought it might be skin cancer. When I examined it, I realized it was actually an area of poor circulation where the tissue was starting to break down. Her feet were cold to the touch. The color was mottled. And when I checked her pulses, the pulses in her feet were very weak. Her blood sugar was 160. She had no idea she was diabetic, but her circulation had already been compromised to the point where tissue damage was beginning. The fourth sign is slow healing. This is one of the most dangerous signs because it opens the door to serious infections. If you get a cut on your foot, a blister from new shoes, a scrape, anything that breaks the skin, and it takes more than a week or two to heal completely, that is a red flag. Normal wound healing requires good circulation, healthy immune function, and proper nerve signaling. High blood sugar interferes with all three of those things. Elevated blood sugar impairs your immune system. It makes it harder for your white blood cells to fight off bacteria. It slows down the production of new skin cells. It interferes with collagen formation, which is what closes wounds. And if you combine slow healing with reduced sensation, which we talked about earlier, you have a very dangerous situation. You might have a wound that you do not even feel that is getting worse every day, and by the time you notice it, it could be infected. Margaret, the patient I mentioned at the beginning, had exactly this situation. The cut on her foot was small. It should have healed in a week, but 6 weeks later it was still open, and the edges were starting to look inflamed. If she had waited much longer, that infection could have spread to the bone. And infections in the feet of people with diabetes are one of the leading causes of amputations. This is not something to take lightly. The fifth sign is extremely dry, cracked skin. You might think this is just a cosmetic issue, just something that happens as you age, but it is not. When blood sugar is elevated, it causes dehydration at the cellular level. Your kidneys are working overtime trying to filter out excess glucose, and they pull water from your tissues to do it. This leaves your skin dry. It also damages the small nerves that control your sweat glands, which is called autonomic neuropathy. And when your sweat glands do not work properly, your skin does not stay moisturized the way it should. Dry, cracked skin on your feet is dangerous because those cracks can become entry points for bacteria. They can turn into fissures, which are deep cracks that bleed and are very painful. And if you have reduced sensation in your feet, you might not even notice the cracks until they become infected. I cannot tell you how many patients I have seen who developed serious foot infections that started with nothing more than dry, cracked heels that they ignored. The sixth sign is swelling. If your feet and ankles are swelling, especially at the end of the day, and especially if the swelling is worse than it used to be, that can be a sign that your kidneys are starting to struggle. High blood sugar damages the tiny filters in your kidneys called nephrons. When those filters are damaged, your kidneys cannot regulate fluid balance the way they should. Fluid starts to accumulate in your tissues, and because of gravity, it accumulates in your feet and ankles first. Swelling can also be a sign of poor circulation or heart problems, both of which are closely linked to high blood sugar. But regardless of the cause, if you are experiencing new or worsening swelling in your feet, it needs to be evaluated. This is your body telling you that something is not right. This is a warning sign that should not be ignored. And the seventh sign, the one that frightens me the most when I see it in my patients, is a complete loss of sensation. This is when you cannot feel temperature anymore. You step into a bath and you cannot tell if the water is too hot. You walk barefoot outside and you cannot feel if the ground is rough or if there are small stones under your feet. You stub your toe and you do not feel it. This is advanced nerve damage, and it puts you at extreme risk for injuries that can become catastrophic. I had a patient, a man in his early 70s, who walked around his house one morning and stepped on a thumbtack. He did not feel it. It stayed in his foot for 2 days before his wife noticed blood on his sock. By the time he came to see me, the puncture wound was badly infected. We had to hospitalize him for intravenous antibiotics. And all of this happened because he had lost sensation in his feet from years of uncontrolled blood sugar. Now, I want to be very clear about something. These signs do not all appear at once. They develop gradually over months or years. You might have just 1 or 2 of them right now. You might have noticed tingling but no color changes. You might have dry skin but no burning. But the presence of even one of these signs should prompt you to get your blood sugar checked. Do not wait until you have all 7. Do not wait until the damage is severe. Here's what I want you to do if you recognize any of these signs in yourself. First, schedule an appointment with your doctor as soon as possible, and specifically ask for a fasting blood sugar test and a hemoglobin A1C test. The A1C test shows your average blood sugar over the past 3 months, and it is a much better indicator of long-term blood sugar control than a single fasting test. Tell your doctor about the signs you are experiencing in your feet. Be specific. Describe exactly what you are feeling and how long it has been going on. Second, examine your feet every single day. I mean, really look at them. Check the bottoms, check between your toes, look for cuts, blisters, redness, swelling, color changes, anything that looks different from yesterday. If you cannot see the bottoms of your feet easily, use a mirror or ask someone to help you. This daily examination can catch problems early before they become serious. Third, take care of your feet. Wash them every day with warm water and mild soap. Dry them thoroughly, especially between the toes, because moisture between the toes can lead to fungal infections. Apply a good moisturizer to keep the skin from cracking, but do not put moisturizer between your toes. Trim your toenails straight across and not too short. Wear shoes that fit properly and do not rub or create pressure points. Never walk barefoot, even in your own home. And fourth, make changes to bring your blood sugar down. This is not optional. If your blood sugar is elevated, if you are pre-diabetic or diabetic, the single most important thing you can do to stop nerve damage and circulation problems from getting worse is to get your blood sugar under control. This means changing what you eat. It means cutting out refined carbohydrates, sugar, and processed foods. It means eating more vegetables, healthy proteins, and good fats. It means moving your body every single day. Even if it is just a walk around the block, it means losing weight if you are carrying extra pounds, especially around your midsection. I know this sounds like a lot. I know it can feel overwhelming. But I have seen hundreds of patients reverse their prediabetes and even their early diabetes by making these changes. I have seen people get their sensation back in their feet. I have seen circulation improve. I have seen wounds heal, but it requires action. It requires commitment. And it requires you to take these warning signs seriously instead of brushing them off as just part of getting older. Your feet are talking to you. They are trying to tell you that something is wrong, that your blood sugar is too high, that damage is happening. And the beautiful thing about the human body is that it gives you these warning signs before things become irreversible. If you catch rising blood sugar early, if you address it now, you can prevent the truly devastating complications. You can avoid blindness, you can avoid kidney failure, you can avoid amputations, you can avoid heart attacks and strokes, but you have to listen to what your body is telling you. So here's what I need from you right now. I need you to like this video so more people can see this information. I need you to subscribe to this channel because I make videos like this every week, covering the health issues that matter most to people over 50 and 60, the things your doctor does not have time to explain in a standard appointment. And I need you to leave me a comment. Tell me if you have noticed any of these signs. Tell me if you are going to get your blood sugar checked. Tell me what other health topics you want me to cover. Your feedback shapes every video I make, and I read every single comment. I truly hope this information helps you take better care of yourself and the people you love. Protecting your health after 50 is not about fear. It is about knowledge. It is about paying attention to the signals your body is sending and taking action before small problems become big ones. Your feet are trying to help you. Listen to them, check them, take care of them. And if something does not look or feel right, do not wait. Get it checked. It could save your life. Take care of yourself, and I will see you in the next video.